Hello students, today we will discuss about the basic osteology of vertebral column. In today's lecture, we will talk how to differentiate the different types of the vertebra in your exam and what are the important characteristic identification feature. So let's start with the first slide. So what is the vertebral column? You know that vertebral column is made up of irregular bones and these irregular bones are known as vertebra. Now you know that there are 33 vertebrae and these 33 vertebrae classified on the basis of different region, and there are 5 regional groups: cervical, thoracic, lumbar, sacral and coccygeal. In the cervical there are 7 vertebrae, in thoracic 12 vertebrae, in lumbar 5, in sacral 5 and in coccygeal region there are 4 vertebrae are present. But later on what will happen that these 5 sacral vertebrae join together to form a single sacrum, while these 4 coccygeal vertebrae join and form a single coccyx. Now in this diagram you can see that this is the uppermost area is known as cervical region, then you will have the thoracic area where you have the thoracic vertebrae, then we have the lumbar vertebrae, sacral vertebrae and lastly the coccygeal vertebrae. Now the further classification you have the true and false vertebrae, and this is based on the mobility of the vertebrae. Now when we will talk about the mobility, the 24 vertebrae of upper region are unfused. What is the meaning of unfused? That means in these regions vertebrae are present as a individual bone, but in the lower part the vertebrae are not present as a individual bone. As you know that 5 sacral vertebrae form a single sacrum and 4 coccygeal vertebrae form a single coccyx. So what will happen? These vertebrae are now not having the individual mobility. So these true vertebrae are upper 24 vertebrae, which include the cervical, thoracic and lumbar vertebrae, and they are mobile and these are known as true vertebrae. The another important thing is that the true vertebrae increases in the size from above downward. So when you will go from superior to inferior, the size become increasing. While when you will see the false vertebrae, they are not having the independent entity because they are having the fusion in the adult life. So they are immobile vertebrae and they are how many in number? 9 in number, and these are known as false vertebrae, and the example is sacrum, which is formed by the 5 sacral vertebrae, and coccyx, which is formed by the fusion of 4 coccygeal vertebrae. So when you will see this vertebral column, you will realize that as you will go down, the size of the vertebral body will increase up to the L5. Then after the L5, the size will decrease like this. So what you are able to appreciate that there are 2 cones. The upper cone is having the apex upward and base downward, and lower cone is smaller, which is having the apex downward and base upward. So this area is from cervical to L5 and this start from S1 to the lowermost coccygeal tip. Clear? Now there are few curvatures present in the human vertebral column. So there are 2 curvatures, one is primary, another is secondary. Now what is the primary curvature? Primary curvatures develop in the intrauterine life and they persist in adult life only in the thoracic and sacral region, and they are named as a kyphosis. So there are 2 kyphoses, thoracic and sacral kyphosis, while the secondary curvature develops after the birth. They develops after the birth and they develop due to the posture, and they are present in the cervical and lumbar region, and they are termed as a lordosis. So one is cervical lordosis, another is lumbar lordosis. Now when you will see the profile view of the vertebral column, you can see that these are the spines. So this is the dorsal surface of the vertebral column and this is the ventral surface of vertebral column. Now Here you can see that this is the first curvature, then you have the second curvature, then there is a third curvature and the fourth curvature. So from above downward, you can see in an adult vertebral column there are 4 curvature. Now this uppermost curvature is having the convexity on the ventral side, then you have concavity on the ventral side, then again convexity and again concavity on the ventral side. So these two convexities are known as lordosis. These are known as lordosis and these are the secondary curvatures, while these two concavities are known as kyphosis and they are primary curvature. Now why we are saying these are primary? Because when you will see the fetus is having the complete placement of vertebral column with concavity on the ventral side, and this concavity of the vertebral column on the ventral side which develops in the intrauterine life persists only in the 2 regions in adult. One is the thoracic and another is the sacral region. That's why this is known as primary curvature, and these 2 curvature develops later on with the convexity on the anterior aspect and they are known as lordosis. Now the question comes is that when these lordosis appears, so the cervical lordosis develop at the age of 6 to 8 months when the baby has full head holding, while the lumbar lordosis develops at 16 to 18 months when the baby start walking independently. So these are the 2 important type of the kyphosis and lordosis which can be asked in your exam. Now we will see the different parts of the vertebra. Now when you will see the vertebra, a vertebra is made up of 2 parts. One is known as body, another is known as arch. Now the body is the ventral part. So when you will see this vertebra, you can see that this large area is known as body of any vertebra. So any vertebra is having the body which is placed anteriorly, while there is a presence of vertebral arch. So this remaining portion is known as vertebral arch of a vertebra. Now behind this vertebral body and between this arch you have the area which contains the spinal cord and your meninges around the spinal cord. This is known as vertebral canal. The body is having the ventral part and it is having the dorsal surface. The body is having total 4 surfaces. This is the one surface which you are able to see. This is the superior surface. Then you will have inferior surface. This is the posterior surface and this will become the anterior surface. Now the posterior surface of the body is having few important foramina. Now in this diagram you can see the foraminas, and these foraminas are for the basivertebral vein. Now this is the question so many times you have in exam. Now here you can appreciate these small foramina. These foraminas are for which structure? Answer is basivertebral vein. And where it is present? These are present on the posterior side of the body of any typical vertebra. Upper and lower surface are rough. So this surface is rough and lower surface is also rough, because you know that adjacent vertebrae will make a joint and that is known as intervertebral joint. Now what about the vertebral arch? Now when you will see this posterior portion, you will find the pair of pedicles, laminas and 7 processes. So what is pedicle? Now the pedicle is a connection which is starting from the posterior side of the body. So this is the area is known as pedicle of a vertebra. Now second is the lamina. Now lamina is this portion. Now this portion is known as lamina of the vertebra or neural arch. Clear? So this has to be very clear in your mind. What is the area is known as pedicle. So pedicle is a connection which starts from the body of the vertebra. And what is lamina? Lamina is the posterior arch, or you can say the posterior most part of the neural arch, and this lamina will meet in the midline on both the side, and it will give rise to a process, and that is known as spine of vertebra. Clear? Now there are 7 processes. One is the spine, so this is the first. Second is the 4 articular processes. So these are the 4 in number. There are 2 superior and 2 inferior articular processes. So this is the superior, and in the same way you will have the 2 inferior. So these are the 4. Then you will have 2 transverse processes. One is this and one is this. So this may be asked in your exam that a classical vertebra is having how many processes? Answer is 7 processes. Clear? Now in these 2 diagrams you can see that this is the body. Then on the posterior side of the body you can see that this area is known as the pedicle. Then this purple marked area is your lamina, which is also here. These green color areas are superior articular process on both the side. These are the transverse process. These are the spine. Suppose we have to mark the parts in this vertebra. So in this vertebra you can see that this is your body. This is your neural arch. Now in this neural arch posteriorly you have the spinous process. Now here this portion is known as lamina. So this is the lamina here. Now this is the pedicle, and these are the transverse process on both the side. And here you can see classical foramen is present in the transverse process. So this is the cervical vertebra, and here we are seeing the lumbar vertebra. So each and every vertebra is having the body, neural arch, and neural arch is having the pedicle, lamina, articular processes, transverse processes, and spine. Now there is one more term is known as, what do you mean by vertebral notch? Now when you will see the pedicle, it is a feature above and below the borders of pedicle. So when you will see the pedicle, above the pedicle and below the pedicle you are having the superior and inferior vertebral notch. Now here you can see that this is the body, and from the body you have this connection which is known as pedicle. Now above the pedicle there is a notch, and below the pedicle there is a notch. So these notch which are present above and below the pedicle are known as superior and inferior vertebral notch. Now what is the function of these notch? So these notch of adjacent vertebra fuse together to form the intervertebral foramen. Clear? And the notch are variable according to the region of vertebral column. Clear? So now in this diagram, if you will see, what you are able to understand that these are the intervertebral foramen. Now through these intervertebral foramen you can see the yellow color nerves are coming out. Clear? And these are formed by the joining of inferior notch of the superior vertebra and superior notch of inferior vertebra. So the two vertebral in the vertebral column, when there is articulation occurs between the two vertebrae, the inferior notch of superior one and superior notch of inferior one will convert these notch into the intervertebral foramina. Now in this diagram you can appreciate that this is again the superior notch, this is the superior notch, this is the inferior notch, and you can see that there is an exit of this nerve. So but the important thing is that the depth of the superior and inferior notch is not constant in all the region of your vertebral column. It is variable according to the region. Now we will see one by one. First is your cervical vertebra. You know that there are 7 cervical vertebra, but we are talking only about identification of typical cervical vertebra. So this is the typical cervical vertebra image, and it is a smallest body in all the your upper 29 movable vertebrae. Then the vertebral foramina is triangular in shape. Now here you can see that this is the triangular vertebral foramina. Apart from that, this is the characteristic feature of the spine of a cervical vertebra. That means it is bifid in nature. So you can see that the cervical vertebra is posteriorly and you can see it is bifid. Apart from that, the transverse process has got a foramina and this is known as foramen transversarium. So this is the foramen transversarium, and through this foramen transversarium, three structures will pass. First is the vertebral artery, vertebral vein and sympathetic nerve. But the question is that vertebral artery is present in the upper 6 cervical vertebrae foramina. The transversarium, foramen transversarium of C7 is not having the artery, it is having the vein and nerve only. Now here if you will see these two images, you can appreciate more important identifying feature like the superior surface and inferior surface you have to identify in exam. For that, when you will see the superior surface, on the superior surface you are having the side projections. Now these side projections are characteristic feature of the superior surface of cervical vertebrae only. So the superior surface is having upward projection lips on either sides of the superior surface. The lower border of the body projects downward in the midline. Now when you will see this image, this is the side view of your cervical vertebra, where you can see that this is a downward projection. Clear? But what is the characteristic feature of the cervical vertebra? One is the foramen transversarium, second the spine is bifid, the third how to identify the superior and inferior surface of the cervical body. For that you have to look for these projections. If the side-wise projections are present, it is always a superior surface of cervical vertebra. Now if you will articulate all these cervical vertebrae, so you can see here this is your first, then second, third, fourth, fifth, sixth and seventh. So these are the 7 cervical vertebrae, and you can see that these vertebrae are having these side lips, and these side lips are the feature of superior surface which are not present on the inferior surface. Inferior surface is having a midline projection downward. Clear? The another important thing is that these vertebrae are having again the basivertebral vein foramina on the posterior side of your body of cervical vertebrae. Clear? Now we will move to the thoracic vertebra. Thoracic vertebrae are 12 in number. Out of these 12, 2 to 8 thoracic vertebrae are typical and they are having heart-shaped bodies. The foramen for the spinal cord is circular, which is known as vertebral foramen. But the important thing is that the spine of thoracic vertebra is long, pointed and it is directed downward. So this is again become the question that what is the difference between the spine of the thoracic and cervical vertebra. The cervical spine is bifid while the thoracic spine is long, elongated and it is directed downward. So now when you will see this type of the image of any vertebra, you have to check that is it a cervical or thoracic or lumbar. So here you can see that the body is heart shaped in nature. When you will see the other features, you will find the spine is pointed and it is facing downward. It is not having any kind of bifid. Clear? Now this is the transverse process and these are the superior articular facets. Now what are the other features of your thoracic vertebra? That inferior vertebral notch is deeper. I told you that the notches are variable according to the region. Now here you can see that this is our superior articular facet and in front of this is your lamina. So the lamina is having the superior and inferior notch. So here you can see that inferior notch is much deeper and the superior notch is very shallower. Another important thing is the body is characterized by the presence of costal facets. Now this is the most important single character of the all thoracic vertebra. I am saying all thoracic vertebra. Now this is the only thing, if somebody will ask you, tell me the single point or single characteristic feature of all the thoracic vertebra, my answer is presence of the costal facets on the sides of all the vertebra. Clear? Now here you can see that this is the vertebral body where you are having the two facets, but it is not compulsory. Some will have one facet, some will have two facets, but though we are talking about the typical, that's why all the typical vertebrae are having the two facets. A facet is also present on the anterior surface of the transverse process. So where on the anterior surface, and it is near the tip of the transverse surface. Now here you can see that this is the transverse surface and transverse process, and on the transverse process a round facet is present, and this facet is for the tubercle of the rib. Clear? So you will realize that a typical thoracic vertebra is having three facets for the rib. One is the superior facet, another is the inferior facet, and one facet on the tip of transverse process on its anterior surface. The another important thing is that superior facet is larger, inferior facet is smaller. Clear? But again, the important thing which you have to keep in mind, that the facets of your transverse process are not constant for all the 12 ribs. So a facet on anterior surface of transverse process, not a characteristic feature of all the 12 thoracic vertebra, but the facet on the body of thoracic vertebra is constant feature. That we will discuss in the coming slide. Now here you have to first keep this thing in mind, that how the typical rib articulate with a typical thoracic vertebra. So here you can see that this is the point of articulation with the body, and this is the point of articulation with the transverse process. Now this is the tubercle of the rib which is articulating here on the transverse process, but you can see that this is the anterior surface of transverse process. If you will draw here, so this is the anterior surface or the ventral side of the vertebra. So the facet is not present on the posterior aspect, it is present on the anterior aspect of the transverse process. Second, the articular facet for the your head of rib is present on the side of your body of thoracic vertebra. So when you will see this type of arrangement, you know that there is a presence of 12 pairs of the rib on both the sides. So when you will see the articulation of these 12 pairs with the thoracic vertebra, it is not having a constant pattern. But the important concept which you have to always keep in mind, that whenever we are talking about the typical thoracic vertebra, the typical thoracic vertebra is also always having the facet on the transverse process on anterior aspect and two facets on the side of the body. Now how a typical vertebra is having the articulation? Now you can see that this is one vertebra. Now this one vertebra of the thoracic region is having the facet for the rib, but you have to understand that a one rib is making a joint with the two vertebrae. Here you can see that this is the end of your rib, and this rib is making joint with the two vertebrae. So this is the first joint and this is the second joint. Now the another important thing is that here will be the transverse process, and this rib is also making a joint with the transverse process here. Now the question comes is about numbering of the rib. So you have to keep this thing in mind, that each typical thoracic vertebra articulate with the two rib. So this is articulating with the two rib, one facet comes here, one facet comes here. So how to number the vertebra and the rib? Superior facet articulate with the same number. What does it mean? Suppose this is the fourth vertebra, then this has to be the fourth rib. If it is a fourth vertebra, then what is the number of the rib? Fourth rib. Then which rib will come here? ultimately you will have the fifth rib that will come here. That means when you are having the articulation of a vertebra with the rib, there are two rib, one is of the same number and one is of the above number. Plus, if I am asking you that what rib will articulate with the transverse process, answer is same number, because it is a transverse process of fourth vertebra, so it is articulating with the tubercle of fourth rib only. Clear? So in case of the tubercle facet, the same, but in case of the body, same plus one rib, that will come on the next in counting. Now here you can appreciate all the thoracic region vertebrae. Now here what you are able to understand, that these are the facets which are present on the side of your thoracic vertebra. But I told you that facets are not present on transverse process. So here you can see that this is the transverse process of 12, this is 11, this is 10, this is 9, 8. So now if you will see this area, there is no process, there is no facet, but facet comes till T10. So facet is not a characteristic feature on transverse process, but facet present on the body is a characteristic feature. So here you can see the facet, here you can see the facet, here you can see the facet. The position of facet can be changed, but facet has to be there on each and every thoracic vertebral body. So this is a very important concept to understand, that what is the characteristic feature of the thoracic vertebra? Presence of the costal facets on the body, not on the transverse process, because the facet on the transverse process is a feature of only typical thoracic vertebrae. Now here if you will see, what you are able to understand, that this is the transverse process of your 11th and this is the transverse process of your 12th vertebra, but there are presence of the floating ribs. So floating ribs are connected directly on the body and they have to do nothing with the transverse process. Clear? Now this is a very enlarged view, and here you can appreciate that there is a clear cut gap. Now this is the gap, and this gap is present between the articular facet on the body of and the transverse process. So there is no relation of this 11th rib with this transverse process of 11th vertebra. In the same way, this is the 12th floating rib and this is the transverse process of 12th thoracic vertebra, and there is a large gap is there. So you have to realize that when we are talking about a typical rib, this is going to make a joint with the transverse process facet and with the body also, but in the lower part you have the facet only on the body. Clear? Now we'll move to the lumbar vertebra. Lumbar vertebrae are having the massive large body with the transverse width is more than the AP diameter. So this is the transverse width which is very high as compared to the AP diameter. The characteristic feature is that spine is quadrangular. So this is the difference between the spine of cervical, thoracic and lumbar. In the cervical we have seen it is bifid, in thoracic we have seen it is pointed, and in lumbar it is quadrangular. Now superior articular facet is concave and inferior facet is convex. Now this is again very commonly asked question in your exam, that what is the shape of facets of lumbar vertebra, because when you will see the shape of cervical and thoracic facets, they are flat, while the superior and inferior articular facet of lumbar region are convex and concave. So the posterior border of the superior articular process is having a elevation is known as mammillary process. So mammillary process is a characteristic feature of the lumbar region and it is present along the posterior border of superior articular facet. Now here in this diagram you can see that these are the superior articular facet and these superior articular facet are concave, and behind this there is a elevation. Now this elevation is known as mammillary process. Now in this diagram, this is the lateral view of the lumbar vertebra, where you will find one more process is known as accessory process, and accessory process is present near the root of transverse process. So where is this? It is here. Now here you can see that this is your transverse process, and near the root you will find this area is known as accessory process. So there are two additional processes which you have to keep in mind in case of lumbar vertebrae. One is this posterior process, and this process is known as mammillary process, and one process near the root of your spine, transverse process, and that is accessory process. Clear? So now if you will see the superior inferior view of lumbar vertebra, the question comes how to identify the superior and inferior surface of lumbar vertebra. For that you have to look for the superior and inferior articular facet. I just told you that superior articular facets are facing inside and they are concave. So these are the superior facets which are having the concavity inside and they are facing medially. Plus there is a presence of process, that is the mammillary process. But when you will see the inferior surface, the inferior facets are facing outside and they are not concave, they are convex, because once it is concave, then and then only this convexity can be accommodated inside these adjacent superior and inferior articular facets of adjacent vertebrae. Clear? Now here you can see how the articulation will take place. So here you can see that the inferior facet of superior lumbar vertebra articulating with the superior facet of inferior lumbar vertebra. So whenever you are having the lumbar vertebra in your hand, it is very important first to identify the superior and inferior surface, and it can be identified by the help of the shape of superior and inferior facets. So you can see that superior facets are facing inside while the inferior facets are facing outside, so that the articulation can be happen. Clear? Now when you will see the lumbar vertebrae, you have to keep this thing in mind. I told you that transverse process of thoracic vertebrae having the your facet for the rib. So here there is no facet, there is no facet present on any of your lumbar vertebra. If the facets come on the anterior surface of the transverse area, then it has to be your thoracic region vertebra. Now here also you can see that these are the adjacent intervertebral notch which are converting these notch area into the intervertebral foramina. Clear? And you can see that these are making the lumbar lordosis, and this lordosis develops after the age of 18 months. Now we will do some exercise here, that if you will have these two images, you have to identify which vertebra is this. So we have read the three vertebrae. So is it cervical? If it is cervical, then the transverse process should have the foramen transversorium, which are not there. Is it lumbar? If it is lumbar, then the body is very large, the transverse diameter is very much. Apart from that, it is having a quadrangular spinous process. But here what you are able to understand, that the spinous process is very sharp. It is very sharp. The body is heart shaped, and you can see that superior and inferior facets are flat. They are not concave and convex. So it has to be our thoracic region vertebra. Now here, if you will have the two vertebrae, how to differentiate? So which one is this and which one is this? Now here you can see that the spinous process is pointed. Here the spinous process is quadrangular. Clear? Apart from that, on the side of body, here you can see the facets which are not present here. And another important thing is that transverse process is also having the facet. The superior facet is flat. Here you have the transverse process. Apart from that, you will have the mammillary process is present here. So this will become the transverse thoracic region vertebra, and this is your lumbar vertebra. Clear? Then here if you will see these two vertebrae from anterior view, again you can differentiate, because here on the transverse process you can see the facets are present which are absent here. Apart from that, If you will see the another thing, the thickness of the vertebral body is very high, and you can see that these are the superior facets which are vertically placed while they are having some kind of medial placement. So this will become your thoracic and this will become your lumbar. Now this is a classical diagram of a thoracic vertebra where you can see again the placement of the facets on the side of the body, facet on the transverse process, and a elongated sharp pointed downward spine. Now this is, you can appreciate, this is our lumbar vertebra. How we have to identify? First the quadrangular spine, and with the help of these two processes, one is the concave, another is convex. Now here I am trying to show you at what level the spinal cord ends. So you have to understand that the vertebral column contains the spinal cord. Now here you can see that if you will remove these lumbar region vertebra, now this is your sacrum, so this is your fifth lumbar, this is your fourth lumbar, and this is your third lumbar. So I have removed the second and first lumbar vertebra. Now once you will remove these, inside the vertebral canal you will find the lower end of the spinal cord. So when you will enlarge this image, here you can see that this is the lower end of the spinal cord which will end here, but the nerve fibers are still arising and they are going downward into the vertebral canal. So what is this level? So this level is the lower border of L1, or you can say intervertebral disc of L1, L2. Clear? So at the end of this class, we are able to understand what is vertebral column, what are the different types of the vertebra, and the most important thing is how to differentiate these vertebrae in exam. Clear? So this is all for today's class. Thank you.